would like to first of all thank you for coming in personally to take my queries on this matter. You know, as we all do in the Midwest, how important an issue it is for us, and I'd like to at the outset acknowledge and thank you for the wonderful news that you gave us yesterday. We've had many, many sad days in healthcare in the Midwest, but yesterday was a really positive one. So thank you, Minister. I'd also wish to just, it's very important that we remember all of the people who have lost their lives prematurely at UHL, and I'm conscious that this week is the 3rd anniversary of Aoife Johnson's death. So just to acknowledge their losses and to thank you, Minister, for putting your shoulder to the wheel and really taking on the challenge that is the challenge most important to us in the Midwest. When we spoke in this House last on the 27th of November, we discussed the HICRA report, and we acknowledged that it laid bare for all to see that the problems that have been accumulating in the Midwest in accident and emergency care is caused by a chronic shortage of acute inpatient beds in UHL. And that did, Minister, you may not have been aware, but that did put to bed for us locally an ongoing discussion and debate about what the root causes were of the problems that we were experiencing in A&E. And it was important that the report highlighted that it is indeed inpatient acute bed care that we require. So while I welcome your commitment also yesterday to additional beds at Nenagh, Ennis and St John's hospitals, just to flag for all that those are not actually acute inpatient beds. Yeah, and that distinction matters if we're to be, clear and direct with the public about what's required to make UHL safe. So I welcome the Minister's commitment to maximising the use of space on the current site at Duradoyle, option A, and in tandem to identify a nearby adjacent site for the extension of services at UHL, option B. And I just have 3 questions, Minister. Can I ask for clarity on whether you envisage the relocation of the maternity hospital currently on the Ennis Road in Limerick to what is option B, the second site adjacent to Duradoyle under the governance of UHL. It would be in line with the long-standing objective of full co-location of maternity services with acute hospital care. Also, I note that the media announcement yesterday, the very welcome media announcement yesterday, didn't specify the provision of a second emergency department for the region. I acknowledge that you've said you'll proceed with option C, and given the scale of population growth with the existing demand and the existing demand in the Midwest, can I just ask, Minister, if you could clarify if it is indeed that you envisage a second ED as part of option C, and your thoughts on that. And then 3rd question, Minister, Oireachtas colleagues from across the Midwest have this morning been responding to the welcome announcement, and queries are coming up around funding. It's noted that the NDP envelope that you announced last week may not support the full funding of the scale of an investment across the Midwest, so perhaps you could give us some clarity on where funding will come from for these projects.
Sure.
Thanks.
Thank you, Senator. And as I said, yes, we did discuss this report in November, and I knew at that point what the approach that I would be taking, and I'm very pleased to have spoken to Cabinet about that first, as is appropriate, and to have secured their support for the approach that I want to take, which is, of course, to implement all 3 options in relation to the HICRA report and the need for additional acute bed capacity and healthcare capacity more broadly in the Midwest. In relation to the proposals, as you said, we're progressing with option A, option B and option C. Option A being the delivery of acute beds on the site. I do, of course, as Minister for Health, thank you for explaining it to me, Senator, understand the difference between acute beds and non-acute beds. I also understand the need for non-acute beds in Ennis and Nenagh a step down and as a key component of patient flow, which the Senator will understand is something that Limerick has improved enormously over the period that I've been Minister for Health, and I thank them for their excellent management and excellent staff, the extraordinary work that they're doing. One of the busiest hospitals in the country, but also the one that is discharging best at weekends, has the highest consultant rostering at weekends, and that is as a consequence of the implementation of the reforms that we have introduced in the last 12 years. So there is no point in putting in additional acute beds into Limerick if you do not put non-acute beds into other places for people to move out of those acute beds from Limerick to somewhere else closer to home. That is the essence of Sláinte care, and that is how patient flow works. So you will, I'm sure, welcome all of those things together at the same time, they being codependent for patient flow to work. The second question in relation to the location of the maternity and the second emergency department, our priority at the moment is to secure an appropriate site in relation to option B as mandated by the government, and to consider all of our options in respect of option C. The best, most appropriate structure for that is to consider that with the best clinical advice possible, and I will be engaging with clinicians on the best way to structure that going forward. Once we have secured a site, an appropriate site, and we have what flexibility that gives us as regards the different options, option A, option B, and the appropriate clinical distribution of the services as they should be distributed across two sites. So I will take, as I'm sure the Senator will, the clinical advice in relation to that and put that at the centre of future development. We have a huge opportunity in the Midwest now to do something that we really haven't had a chance to with many other hospitals, which is to have a genuine fresh start. A genuine fresh start. I've spoken to health ministers from around the world, including when I was at the G20, from Singapore, from Indonesia, from Norway, all about the different perspectives and what they're learning about how to design hospitals best, what is the right size, what's the best clinical distribution. And we in Limerick and the people in Midwest will be, I hope, the beneficiaries of the fact that we have a really genuine opportunity to think quite differently, and the clinical community will be absolutely at the heart of that, and the patient forum and public representatives will be at the heart of that, and we will take the best clinical advice we can as to how to distribute services across the Limerick region and across the Midwest more broadly. It is, of course, as important for the people of Limerick as it is for the people of Clare that more services are delivered away from UHL and into Ennis, and that is why a full understanding of integrated care for the region is as important for the people of central Limerick as it is for the people of Clare, because everything that is delivered appropriately in Clare releases capacity for the over-congested site that is Duradoyle, all of the traffic implications for the people of Limerick, and the need to move care in appropriate ways elsewhere. But the first and most important thing is that we have now Cabinet approval. And we have a plan, and I have mandated the HSE to go and get the appropriate site. In respect of funding, could I ask the Senator to go and speak with our excellent colleague, Minister Jack Chambers, in the Department of Public Expenditure and Reform? Of course, that he will be a key part of that. Of course, I have the funding for the relevant site, but as in all things, I have, like all ministers, a limited capital envelope, but where I get projects to shovel ready, I have a commitment from Minister Chambers that they will, of course, be funded, irrespective of the capital envelope as it is now. Our bigger challenge is not the allocation of funding at the other end, but getting projects to shovel ready. So Minister Chambers is responsible for two pieces here: implementing the terms of the accelerated task force, the infrastructure task force, and actually making sure that his officials make sure that that is implemented, and then providing the capacity to fund in a range of different ways. And I would welcome the Senator's support with both of those crucial things for the people of Midwest to make sure that her party colleague delivers for them.
Thank you, Minister, and that's great news. Delighted to hear that Minister Chambers will be supporting us in this, because I know he won't be found wanting. Looking forward to hearing your decision on the maternity hospital relocation, and we would of course be advocating for the relocation and co-location of it closer to UHL. And Minister, just in closing to say, while of course yesterday's Cabinet decision is very welcome and is nothing less than what the people of the Midwest need and desire, it is of course a long-term plan and long-term pathway to safer care. And the reality is that patient care for people in the Midwest is no different yesterday to today, to tomorrow, to next winter. And for me, that does remain unacceptable. So it will be 2029 before the next major block of acute beds will be delivered. And I'm firmly of the view that urgent interim measures are required in the years between now and then. I'll continue to engage with you, Minister, on what immediate actions can be taken in the interim for the people of the Midwest while we await delivery of this very welcome medium and long-term solutions.
Thank
you so much. And it's great to see how much Limerick has improved over the past year and how it has improved. I'm so disappointed to hear this constant doing down of Limerick, because actually its performance, particularly since the 96-bed block has opened, has been quite extraordinary. Yesterday, there were we look at the HSE figures every day. This morning, there are 248 people on trolleys. Our threshold for what is tolerable is 280. So it's like a good summer day today, and we're right in the middle of flu. Yesterday there were 18 patients on the HSE figures, which is what we track throughout all of the hospitals. There were 18 patients on trolleys. In Galway there were 39. Last week, in the same way, Limerick was outperforming Galway and other hospitals like Galway across the west, northwest every single day. And the work that they are doing to make sure that that is being delivered is based on weekend discharging, consistent patient flow. I mean, last weekend there was 34 patients on trolleys on Friday, 9 on Saturday morning, 15 Sunday morning. It went up to about 30 on Monday, and then down to 18 yesterday. But the performance is consistently better, and I want to thank every person in Limerick who is making that possible.